welcome to this special series of
Yes,
Safe
yes,
Motherhood. And who can be
absolutely.
better than you, who is being an advocate and awareing through your videos about the virtue baby and also the different issues that the women is facing and how we can combat that. So thank you so much for coming in the series.
Thank you, my dear. Thank you so much. Yeah.
So just let me just introduce Dr. Nitika Sobti to all of you who are joining us. Dr. Nitika Sobti is an obstetrician and gynecologist in Gurgaon who not only provides compassionate and quality care to patients of all ages, but she is also the founder of Virtue Baby, an initiative that stands for the holistic care during pregnancy and childbirth and the overall development of the baby. So not wasting any time and beginning the session with you, Dr. Sopti.
Absolutely.
Please
Absolutely.
share some of the causes, like we are discussing about placental abruption today, which many
Yes.
of us are facing, and I too
Yes.
have a personal story associated with it. So, what are
Okay.
some of the
Okay.
causes of placental abruption? Is it a genetic thing or it's normal? Like it's natural, anybody can have that.
Yeah. Very important, my dear. Actually, placental abruption is a very, very specific complication. जैसे अगर हमें कोई पूछता था ना कि placental abruption, the complications of pregnancy क्या है? So the first thing as an obstetrician what comes to my mind is abruptio placentae, because that's the actual obstetric emergency. Because I practice in Gurgaon, so there are जो
Hmm.
NCR के आसपास there are so many patients. They always ask me, ma'am, I'm coming from Noida, I'm coming from Faridabad, I'm coming from Delhi. What will happen in Gurgaon if it takes 2 hours for me to reach? I'm in labor. So I said, labor is a very, very long process, my dear. You can come take 2 hours in the car, or you can keep strolling in the hospital for 6 hours to 10 hours to 14 hours. It's the same. They say, no, but we've heard that we should immediately reach the hospital. I said, there is only one reason to immediately reach the hospital, and that is placental abruption. And that is in 1% of all pregnant parents. But the only thing is, my dear, for the person who has that, it doesn't matter that 99 pregnant women didn't have it.
True.
For that 1%, it's a all or none. So it's not
True.
very common. Why I told you this story? Because it's
Hmm.
not very common. But if we have it, then it's a real emergency which needs immediate attention and urgent intervention, because there is a lot at stake for both the mother and baby in this phase.
True.
I
True.
still remember I was in, I think 15 years back. I remember that case so well, because when you take out a live baby after this calamity, you feel that actually divine presence is working with you. Because ये सिर्फ डॉक्टर के हाथ का काम तो है नहीं. हमारे लेबर रूम की ही सिस्टर थी, very thin, lean sister. She was on a pregnancy journey. She was about 30, 31 weeks. I don't know how, just while talking, her face just flashed on my, in my mind screen. So I was doing my OPD, and she was also on duty because she used to manage the labor flow. She was, I think, 30 weeks, something, between 30, 31. That's it. And she said that I'm feeling a little discomfort since morning. So I said, okay, no problem. You have a crocin, because in working in hospitals and all, it's a challenge.
Hmm.
So I thought, just take some
True.
rest and have a crocin and take some Digene. If you feel better, it's okay. Otherwise, you come down. I'm down only sitting in the OPD. I think इतनी बात ही हुई होगी, and आधा घंटा निकला होगा. And the other sister said that she's screaming in pain.
Hmm.
I said, screaming in pain? Bring her down, let's get the ultrasound done. So the moment she said, no ma'am, but she's bleeding also. I said, अभी आधे पौने घंटे के अंदर इतना कुछ. And फिर मैंने कहा, and I ran up the stairs. I was on the 4th floor and our labor room was on the 8th floor. When I ran, her baby's heartbeat was 40, 44. And the normal heartbeat of the baby is 120 to 160. And she was bleeding. Honestly, I didn't even waste a minute to even check whether it is placental abruption. But the moment I touched her belly, it was tense, it was tight, and she just She just had a sudden abruption. So sudden, and we shifted her with that Doppler to the OT. We took out the baby clean in 8 minutes from the labor room to the OT. And when they took out the baby was put on ventilator because it was about 980 grams baby at 30 weeks. What else do you expect? Because she was herself also a South Indian thin, lean sister.
I
So
can
if you ask
understand.
me, yeah. So you asked me whether it is natural, whether it is genetic, what are the risk factors. Next, you will ask what are the causes. She had no risk factor. But generally, patients, pregnant mothers do have little factors, but generally it is causes not known. We really have no idea. It can happen suddenly, acutely. It can happen little by little. Little bleeding can keep continuing. So that's a chronic abruption. But generally it occurs after 20 weeks.
Okay.
And more than 70% of cases will be in the third trimester. That is after 30 weeks, 28, 30 weeks. So
Because I experienced in 31 weeks. So then
that is what I told you, no? At 31 weeks, this is the main time.
So what are some of like now so since I have also suffered it, so are there any ways that we can prevent placental abruption, or there are like if anyone can have like it's like you mentioned it's a sudden
See,
thing.
there are a few risk factors, my dear, with जो हमें पता होने चाहिए. And thankfully हमारी country में वो risk factors इतना role नहीं play कर रहे थे. But now with the advent of IVF pregnancies, with the advent of multiple pregnancies, with such a lifestyle shift, so विशा बहुत changes हो गए हैं. Smoking is associated very strongly with this abruption.
But talking about like my case, like before pregnancy, only 6 months before, like we were totally on to vegetarian diet. Like I am a pro vegetarian, but then everything outside food, you were not having no junk food, and I also like you mentioned there was no complication that I suffered. The only thing I like during this placental abrasion, what I was suffered, I just went for a walk. And after coming back, everything was fine. And later at night, suddenly it started bleeding.
Yeah, that
And
is
then
what I
we
said.
dragged the pregnancy.
Yeah. So that is what I said. Some patients will require immediate attention and intervention, and some we can prolong. But generally, it is immediate attention. Generally, you can't prolong it. Because if you start bleeding, then there is no way to control or put a stop to that tap. But causes, smoking plays a very big role. Although, but in India, it's not too common. But now it is coming up in a big way because alcohol and smoking is a part and parcel, at least in Gurgaon and in all big metros. Everybody feels that this is a very normal way of living. So when we start planning, then we will stop 3 months to 4 months before that. But there are certain cellular level changes which happen in our body. So when the placenta is forming, even if you have detoxified yourself for 3 to 6 months, still our cellular level changes don't go away. So that leads to reduced functioning of the placenta. And that is one of the very important causes of abruption. Things are being studied on it. There is nothing definite. But yes, age over 35 years, that's also one risk factor. Getting a IVF pregnancy is also one risk factor. If you have a first trimester, जिसमें हम कहते हैं ना कि first 3 months में bleeding हो गई, थोड़ा सा hemorrhage हो गया, there is a subchorionic hemorrhage. That means there is little bleeding which is happening in the membranes.
Okay, because
Between
I
the
suffered with
chorionic
the
membrane.
subchorionic hemorrhage, like you mentioned, during ultrasound. I got that.
So that also gives us a little indication, but we can't do anything to prevent it. That gives us a little indication that maybe yes, this placenta is a little weak on attachment, so we should not have an issue. And supposing with this factor now, if you have a high BP, if you have lot of water inside, the overstretched uterus, or suddenly if you have a water leakage, a big uterus, a tense uterus suddenly contracts, तो वो placenta अपनी जगह से हिल जाता है. So these are all causes. So if we talk about genetic, If you had one abruption, so you have to be a little more on guard that there are 10% chances of
Okay.
repeating.
But then, oh.
Yes. And if you are smoking, not you means, because in the West, smoking is a very common thing. If you are smoking, then the chances are 40 to 50% of having an abruption.
Hmm. Today morning only while we were like we announced about your session, so we got one queries. One of my friend's
Sure,
friends,
sure.
she just told me that the friend of hers is a 6 month pregnant woman and she's completely on bed rest and she's experiencing contractions. So that is also one of the reasons, like or they are symptoms of placental abruption.
No, no. See, placental
Okay.
abruption, it will lead on to preterm labor, it is fine. That I agree.
Okay.
But a
Hmm.
preterm labor preterm labor is a consequence of a placental abruption.
Okay.
But having a preterm labor doesn't predispose you to have a abruption of the placenta. And when we talk
Okay.
about abruption of the placenta, you have to understand, meaning the placenta is attached on the wall of the uterus. Now, placenta, what is a placenta? Placenta is a thick muscular mass which is comprised of blood vessels. It has loads of blood vessels, and from the placenta the cord is coming and it is going to the baby's umbilicus. So and it is attached on the wall of the uterus. So whatever the mother is eating, feeding, it is going to the placenta through the uterine wall, and from the placenta it is going to the cord, and from the cord it is reaching the baby.
The baby.
Yeah. So now that placenta, if the uterus is contracting time and again, that may lead to abruption, because uterus की wall अगर contract करेगी तो उसका surface area कम होगा, but बहुत rare. But अगर placental abruption हो गई है, so labor excite हो जाएगी, because कुछ भी excessive fluid or blood will tell the uterus, will give a signal to the uterus the baby has to be out, because the baby is not comfortable inside. Because if the uterus has moved away from the uterine wall, how will the blood reach the baby? So that is what I said. Sometimes that bleeding is little by little and it's chronic abruption. So that may be prolonged by admitting in the hospital and by observing and doing serial ultrasounds every day.
Because
But
I've observed
otherwise,
Doppler. Yeah.
yeah,
Because
because
I
that's
went
the
through
only
the
way to know
Doppler.
it. Yeah.
So
There's
we
no
waited
other
till
way
the
to know.
last day. Yeah, we waited till the last day, but then it was safe to bring her out. So thankfully, we decided with that thing, and now she's perfectly fine.
Yeah.
But then, is a placental thickness also, if on ultrasound, if we get to know that the placenta is thickened, so that is also
Yeah.
one of the indication that abruption might happen soon.
Uh, Not exactly. There are a
Okay.
lot of studies which have been done, but placental thickness generally, placenta is thick in certain conditions, like if the baby is big, if the baby is swollen, like fetal hydrops, or the mother has diabetes. In those cases, the placenta is a little thick. And supposing you have high BP or a small baby, then the placenta is thin. Moreover, if you have infections also, torch infections जो हम करते हैं screen, उसमें भी placenta कभी-कभी thick होता है. But
Okay.
thin generally it is there if the BP is high or if the baby is growing less. That doesn't lead to an abruption.
Okay.
Thickness of the placenta. But if the placenta is thick or it is thin, that may give an indication that you may have issues in pregnancy, which may not be abruption, but which may need a early delivery and more monitoring of the baby. But abruption generally cause नहीं होती है thickness से.
Okay. So as you have mentioned that in chronic we can prolong. So if for those who might be facing chronic abruption, so how they can like prevent, obviously preterm delivery, you already mentioned it will be early delivery. So during that
Yeah.
prolonged thing, what all care that they can take or precautions?
See, they need to be hospitalized. That is a mandate. Any abruptio patient has to be hospitalized. That is very, very important. And if you are less than 34 weeks and you are not bleeding too much, on the ultrasound and on non-stress test, which we do for our babies, if that is fine, then we keep doing daily ultrasounds, we keep doing daily NSTs, or 1 day alternate day NSTs, and we keep monitoring the baby जब तक वो baby viability के format में नहीं आता, which is around 34 weeks. And we also give steroids to the baby. This is also one notion, my dear, that they say कि steroid देने से baby को नुकसान तो नहीं होगा, हमारा baby को steroid दे रहे हैं हम, steroid is like very big. So I tell all my pregnant parents, our body is composed of lot of cells which are only and only governed by hormones, and all hormones are 90% and above steroid hormones, which nature has made, we have not made. So that is why if any hormone is not working well, generally a steroid hormone is a replacement for that hormone. So कहते हैं ना कि एक बेसिक रेसिपी है खाने में, अभी कुछ समझ नहीं आए तो बेसिक डाल दोगे तो कुछ तो बन ही जाएगा, कुछ स्वाद तो आ जाएगा. सिमिलरली वो स्टेरॉइड हार्मोन भी एक बेसिक लाइफ सेविंग हार्मोन है. अगर कोई का काम नहीं कर रहा तो वो देने से एटलीस्ट हम सैल्वेज कर लेंगे. तो दैट स्टेरॉइड हार्मोन एक्ट्स एज अ बूस्ट फॉर आवर लिटिल बेबीज लंग्स टू सिक्रीट दैट chemical which is important for breathing of the baby.
Surfactant, because
yes, you must be knowing about it because एक बार अभी अपने साथ हो जाता है ना तो पता है.
True.
So बहुत important.
अभी हुआ भी बहुत जल्दी है ना.
तो इसलिए ये ध्यान रखना है बस. Yeah, I know. So इसलिए हम इतना ही prolong करते हैं कि 30 या तो 34 weeks तक हम ले जाएं प्रेगनेंसी को. दूसरा हमारे को स्टेरॉइड एक्ट करने का टाइम मिल जाए. But like I told you that story of my one sister in the labor room. No? अब अगर if I'm getting a fetal heart of 40, मेरे पास सोचने का भी टाइम नहीं है उसमें, मेरे पास देखने का भी टाइम नहीं है, बस सिर्फ एक फील आ रही है एक सेकंड हाथ रख के कि ये शायद अब्रप्शन हो सकता है. And then immediately निकाला करा, we took out the baby was put on ventilator, we finally could salvage the baby. And when we saw the placenta, and there was a big clot behind the placenta measuring about 6-7 centimeters. क्योंकि जहां पे आपका placenta वो निकलेगा, अब वो तो blood vessel से भरा हुआ है ना placenta, so वो वाली vessel bleed करेगी, तो वहां वो blood clot करेगा. So that's the mechanism of abruptio placentae. और मैं सबको कहती हूँ जैसे how can we prevent it? मैंने कहा you can't prevent a placental abruption, but you can definitely avoid alcohol, tobacco, smoking. These are things which you can avoid. And take care of your BP. Your blood pressure should not be high. So although all of us as gynecologists हम बहुत ध्यान रखते हैं, but फिर भी because high BP एक बहुत important factor बनता है abruption cause करने का.
Yeah, because during my journey only I met one mother, like hers was 28 weeks. So her placenta also, and she had twins. So one baby is still in NICU. I'm constantly in touch with her. It's been 3 months, and the little one is there. The big one is still home, but this little one is there. So because of the little one, her placenta got ruptured. The other placenta was fine. So such kind of issues also comes up. If it's a
Absolutely, that is what I said. The risk factors में सबसे important risk factor तो twins है ना, multiple pregnancy जो मैंने बोला, वो तो एक risk factor है ही. Elderly gravida. आज भी मेरे पास एक patient आया, मतलब patient क्या, एक basically they were having, they were just going to get married in May only. So age was 29. So I did a premarital counseling, and then they said कि ma'am, we want to have children only after 5 to 7 years because we want to focus for 5 years on our career. And ma'am 35 के बाद problem तो नहीं है ना, conceive तो कर सकते हैं ना, ऐसा तो कुछ नहीं है कि हमारी fertility drop हो जाएगी. मैंने कहा the very fact that you asked me this question, so in your mind you know that I will not say that fertility doesn't reduce after 35. Knowing the facts, you take decisions. Then you are responsible for decisions. But now people get married only at 34, 35. So what are you going to tell them that no, don't have pregnancy after 35? How can you say this? But Manika, you are coming to me at 29. To you, I will definitely say, don't wait till 35.
Actually, a lot of us have this mindset. Let's first focus on a career because that was where I was also somewhere there, and I planned in 32. So somewhere I
हाँ
got. So now I came to understand get why people used to say कि नहीं जल्दी करो जल्दी करो.
देखो, द पॉइंट इज कि हमारी बॉडी की एक एज है, वो एज करते हैं, वो सेल्स एज करते हैं, एक्स की क्वालिटी ड्रॉप करती है विद ईच पासिंग ईयर. Now, it's not that at the eye today also I have delivered a lady at 41 years. And that was a natural pregnancy and the baby is healthy. We are not trying to say that गड़बड़ हो जाती है अगर हम 35-40 पे भी करते हैं तो. But हो तो सकती है ना. Because the risk of having issues at 25 is 1 in 1800. But at 38 it is 1 in 600. And at 42 it is 1 in 50. फर्क नहीं है क्या? So we have to choose. We should know the facts and then choose what we want. So we are choosing our baby's health. We are choosing the destiny of our child. So, and मैं सबको कहती हूँ, don't wait for your careers. In COVID, everybody has had a break in career. लोगों के 20-20, 30-30 साल से चलते हुए काम they have stopped. And they are again coming back and restarting. So life has not ended. We're all doing it, no? Yeah, so why wait for that perfect, system outside? Just take care of your inner world, and that is what Virtue Baby is for. I want to tell you about complications. I want to tell you about interventions. I want to tell you about the power of your own mind. You as a mother really need to take care of the choices you make. They have to be the best for that new life which has to come. God has given us this beautiful, beautiful exercise, beautiful, work of creating a human baby within us. So we need to be very, very clear about the do's and don'ts even before we conceive. Because our body and mind is going to have a very, very deep impact on the developing body and mind of our baby. We are not trying to say that if we do everything perfect, we will not have issues. And I don't ever use the word complications in Virtue Baby. I always say they are small issues. They are small challenges. And we are going to cross it. जैसे आजकल मूड भी खराब हो जाता है तो बोलते हैं मुझे तो डिप्रेशन हो गया. मैं तो बिल्कुल आज तो मुझे लग रहा है मैं तो बिल्कुल टेंस हो गई हूँ, स्ट्रेस्ड हो गई हूँ. भाई ये बोल दो मेरा मन अच्छा नहीं है.
I think switch
words ही हमारा वर्ड है. Yeah. So छोटा सा इशू है, थोड़ा सा बीपी हाई है, थोड़ा सा चैलेंज आया है, थोड़ी ब्लीडिंग हो रही है, कोई बात नहीं. माय बेबी इज वेरी स्ट्रॉन्ग, आई एम वेरी स्ट्रॉन्ग, वी आर बोथ प्रोटेक्टेड बाय गॉड्स लाइट एंड माइट. My baby is going to be wonderfully taken care. Even if the baby comes out a little early, the nursery is very good. The doctors and sisters will take care. And I am going to send loving, powerful vibrations to my child to come back to me soon. Healthy, healed, and happy. Because God has decided the destiny of my Virtue Baby. We have to keep saying it. बाकी जो होगा वो we'll manage ना. We are there. इतना पढ़ के यही कर रहे हैं.
True. So I think that is how we have to once ठीक है वो सिचुएशन आ गई लाइफ में but then it's us up to us कि एक पॉजिटिव माइंडसेट के साथ we can go ahead and give the positive information to the little being.
Yes, very important. 34 weeks के बाद अगर ये होता है then we don't have too much. Then we immediately we give a steroid and अगर हमें टाइम नहीं भी मिला एक डोज के बाद तो हम जल्दी भी कर सकते हैं. सिर्फ 34 weeks तक के लिए we have to just keep contemplating that whether we do take the baby out or let the baby be inside. So this all just goes on generally till then. But luckily, as I said, 70% of patients will have this only in the third trimester after 30-31 weeks. So that is also nature's grace. Otherwise, अगर 20 पे हो जाए तो क्या करें? कुछ नहीं कर सकते. Viability नहीं है. Viability नहीं है.
Thank you so much, Dr. Sobti. It was actually an eye-opening session for all of us. It's not that ठीक है हो गया, but life में कैसे उस चीज को face करना, that also you very beautifully mentioned how we have to take it and some precautions that I think I'm sure a lot of women was listening to us, and from other cities if in case they are having any kind of smoking or indulgent alcohol, because in parties generally these days people do. So just for that particular time, let's detoxify and then let's raid.
Yeah,
Because
because still at least you have this prime responsibility of bringing a new life into this world. Just abstain and refrain. You know why I need to talk it on forums? I need to be true to everybody. We need to understand the responsibility which we carry towards our own child, towards the society, because you are the building blocks of a healthy, happy future generation. It's not just a word. We are the ones who are creating the generation. So we should know. And second important thing which I would like to highlight, that when you have these complications and challenges in this pregnancy journey, sometimes it takes a lot of toll on the mind of the mother,
yes,
which we are not addressing. We feel ठीक हो ही जाएगी, थोड़ा सा स्ट्रेस हुआ है, प्रेगनेंसी थोड़ी टफ थी ना, अभी बेबी आ गया ना पास में तो हो ही जाएगी. Healing is very important. The postpartum phase needs to be taken care of. So I have actually made meditations for all three phases of this pregnancy journey. When you are planning, what you need to listen to. During pregnancy, what you need to listen to. And after your child has been born, what you need to listen to. Because postpartum is not 40 days.
true.
Postpartum phase actually extends from 6 months to 1 year. Are we taking care of our mind? And especially, you know, like you had to actually have your baby in the nursery. We need to talk about it. Your cells should not remember that trauma of giving your child to the nursery for 2 months. Waking up every morning with that prayer that, oh God, let my baby be very well. So these are
Because
small,
a
small things which we
lot
have to
of
heal.
things actually, yes, because
Yeah.
there are a lot of things. It's not only in nursery, because like you mentioned, the ventilator thing, then the CPAP, there are a lot of
Yeah.
things, the blood transfusion. So when I went through all this, but there was one positivity, because both me and my partner, we believe in positivity. I think that is where
Yes.
we have been touched upon. Somewhere the divine presence has today met both of us, because I
Yeah.
have seen you all into BK Shivani's, a lot of things, and I myself follow that. So I think somewhere
Yeah.
that positivity and the thoughts that we create in mind is something. So till
Yes.
that, throughout the 2.5 months, we go as a happy-go-lucky person over there, and we will actually counseling other parents who were like feeling depressed.
Yeah.
So that is where
Yeah.
I thought, why not bringing such kind of series so that we can aware more and
Sure,
more
my
people.
dear. Absolutely. We are always there, and you've created such a beautiful platform. Only people who are positive, who are generous, who are connected, who understand the feeling of bonding will only create such platforms. We have to have our own soul consciousness to that level. So that is why you are here today. And you are actually changing lives of so many mothers. And good God connected us. So maybe we
Yes.
have bigger things to do together.
True, true. Thank you so much today for joining us and
Sure,
giving
dear.
your time for this such an important topic. Thank you so much again. And it was
Okay,
lovely
my
having
dear.
you today.
Thank you so much. It's my pleasure. Thank you. Okay, bye.